We'll start off with the straight leg rise for hip flexion. For this one, we will need the person to lay flat on his back with arms at his sides, palms up. Keep both legs straight, toes pointing up, and maintain a neutral low back curve. We will evaluate the result based on the rate of motion which the ankle bone of the right leg passed beyond the midpoint of the opposite front. We did the active test first, and the result of the active test is level 4 on his both legs. And for the passive test, same position but with somebody's help, he scored a level 4 too on both legs. Then we did the shoulder reach test for the shoulder flexion. First, the person will make a fist with from his test arm tucked inside to standardize, and he will raise the arm straight overhead, keeping shoulders back and down. We will evaluate the result through the rate of motion of the test fist cross the level of C7, the prominent bone of the base of the neck. For the active test, he scores a level 2 on both arms, and for the passive test, he scores a level 3 on both arms, with the right arm goes further. After that, we did the weight-bearing lunge for ankle dorsiflexion. First, the person will take his shoes off, heel off, front foot must stay on the ground, feet hip width apart, toes pointing forward to isolate ankle dorsiflexion. We will evaluate it through the distance of the test legs, knee to toes. When doing this, the knee stays aligned with the hip and foot. For the active test, the result on the right leg is 15 cm and the left leg is 13 cm, showing that he has a level 4 rate of motion. For the passive test, the right leg is 14 cm and the left leg is 16. Lastly, we did the lower quarter Y balance test for the Y balance reach. For this test, the person will take his shoes off and stand with the stance foot at the center of Y tape on the floor. Movable object is placed at the end of the reaching leg. While balancing on one leg, use the other leg foot to push the object as far as possible along the 3 directions. As a result, for the anterior direction, his left leg reaches 71 centimeters, his right leg reaches 79 centimeters. For the posterior lateral view, his left leg reaches 86 centimeters and his right leg reaches 77 centimeters. And for the posterior medial direction, his left leg reaches 91 centimeters and his right leg reaches 87 centimeters.
Ability test, we can clearly see the difference between the passive test and versus the active test. For instance, the result of the hip flexion test for the client shows both legs reach level 3 actively but level 4 passively, demonstrating that the joint has full potential, but the client's muscular tightness is holding the score back. Similarly, in the shoulder flexion test, the right arm stayed at level 2 for both active and passive, but conversely, on the left side, the client reached level 2 actively and level 3 passively, showing that a bit of assistance will help him go farther. When we check the ankle dorsiflexion, the client reached about 13 cm for active and 15 cm for passive test on the left, and 14 cm active and 16 cm passive on the right, which lines up with level 4 overall. In conclusion, we see that the passive range was slightly greater, which suggests that the limit comes more from the muscle control than from the joint structure itself. For the Y balance test, we have observed a much further reach in the posterior medial direction compared to the posterior lateral direction. It is reasonable due to the strong ankle dorsiflexion our client has, which is level 4 for the both side and both tests. Instead, the difference in reach is more likely to tied with the hip mobility. Since the hip flexion was only level 3 for active, that slight restriction affect reach, especially in the direction requiring hip engagement, since the white balance test integrate dynamically with the mobility and stability. Every small difference in his control and flexibility can result in a big difference in reaching distance. For the last part, we chose client A, Jaden, who just started salsa lesson and wanted to improve mobility. The same 4 tests are ideal for him, since the passive and active mobility tests will help him find which joint are tight or lack control, critical or dense, where hip and ankle movement, drive turns, and footworks. The white balance test show how stable and coordinated Jaden is when shifting weight between legs, which salsa demands constantly.